Just like the street lights lit this town, like a fire in a blaze, gotta burn it down. Can't be afraid to leave this out. We got this far, don't know how.
Well, good, and thank y'all for always watching and staying tuned in to the Also Live channel. And you already know what time it is. Y'all really done walked into like these great vibes. And now that you here, y'all really need to understand that my vibe attract my tribe. And if you really function with me, y'all already know how we gonna rock. Y'all know how we gonna slide. Point blank period. We popping up. We ain't really gotta do too much. I am also legit. I am also authentic. And I'm also outspoken for the little YouTube thing. And for those that don't know, you finna find out that I aspire to inspire before I expire. We finna get right to the video because I don't wanna do too much time about me. Put the light on bro for a second. Dr. and Senator Scott Jensen talks about COVID-19.
Hi, Senator Scott Jensen. I represent Carver County. This is one of the most important videos I've made, and one of the hardest. Frankly, it's been a very difficult decision to make whether I even wanted to do it. Less than a week ago, I was notified by the Board of Medical Practice in Minnesota that I was being investigated because of public statements I had made. They listed 2 allegations. They said I've been spreading misinformation in regards to the completion of death certificates on a news program, which happened to take place on April 7th. And you could find that one. It was with Chris Berg if you wanted to.
Let me just say, my hat goes off to you right now for speaking what you finna speak.
And the other allegation was that I provided reckless advice in my willingness to compare COVID-19 and the flu. When I got this letter, I was ticked. And quite frankly, I leaned into the comfort and wisdom of my family to help them, let them talk me off the cliff.
Thank you to his family for definitely walking him off that cliff and for helping him come to a better understanding.
But doggone it, if this can happen to me, my view is it could happen to anybody.
It can happen to anybody.
I mean,
everybody.
I've been a family doc for 40 years. I work hard. I love my patients. I do house calls. I've been medical director. I've held staff positions in hospitals to help make things work better. I've been in the Senate for 4 years and I've learned a lot. I've never had anything like this happen. Shoot 'em out. 5 years ago, I was named the Minnesota Family Doctor of the Year in Minnesota. And I get this because a couple people complained and I don't get to know who those people are.
That's crazy. A couple of people said that they ain't like what you had to say, and now all of a sudden your voice has been cut off.
I don't know if they're routinely in a political camp, if they're activists. I've gone online and looked at what it takes to complete a complaint that the Board of Medical Practice has to follow up on. It's a one-page deal.
One page.
You can say what you want. You could be a huge donor for the other party, and I wouldn't get to know it. I wouldn't get to know if you live in my district. I don't get to know anything. I checked. So, here I am. I've spent the better part of the last 6 days preparing a response. I understand how important the work is that the Board of Medical Practice does. I mean, physicians do screw up.
Like he said, he understand the work, the everything. He understand. So, don't get him misunderstood.
2 of the big areas where physicians mess up is inappropriate sexual behavior, inappropriate self-medicating, certainly with opiates. But this is an odd position for me to be in, and I am just stunned. But I should have seen it coming, because I saw the threats on social media. I've seen them for the last 2 or 3 months.
He been getting the threats. He's seen them.
I've seen them come from physicians. I've seen them come from
his
people
own
in all
people.
walk of life. They didn't agree with me. They didn't like it, that I was trying to provide some context for the flu, for COVID-19. We've had some 35, 40,000 cases of COVID-19 in Minnesota thus far. According to the Department of Health people, that might translate into 10 times that many. And if it does translate into 10 times that many, that's 350,000 cases.
He's speaking on it.
But in 2018, we had more than 500,000 Minnesotans with the flu. When I say that, am I recklessly giving you advice regarding COVID-19 and the flu?
Is he recklessly just giving y'all misled guidance? Like what? Is he really doing that?
Dr. Anthony Fauci has come out and compared them all the time. Dr.
Hey,
Michael Osterholm has.
All the time.
In terms of the death certificates, on April 3rd, I got an email from the Department of Health that said very clearly that we should report COVID-19 on death certificates if it is assumed to have caused or contributed. Well, that's not how we do death certificates.
That don't sound legit either. So you pretty much saying that if I go in there for a code, that y'all gonna say that I got coronavirus? What?
The official ICD-10 coding for April 1st, 2020 through September 30th, 2020, during the time frame in question, says this: if the provider documents suspected, possible, probable, or inconclusive COVID-19, do not assign U07.1, which is COVID-19 disease. It says, assign a code explaining the reason for the encounter, such as fever, or a cough, or shortness of breath.
Explain.
That's what the official instructions say.
That's what they say.
So I get this on April 3rd. I end up inadvertently, sort of accidentally, running it up the flagpole with Chris Berg on April 7th. And what happens? The Department of Health, a few days later, comes out with a clarification. And then a few weeks later, they come out with another clarification. And I appreciate it. Fact of the matter is, I'm proud of the Department of Health in Minnesota for saying we are not going to list non-confirmed cases as deaths in Minnesota. We are going to put
We ain't gonna list them.
an asterisk by them, and we'll follow up on those later.
Shout out
But
to
that's not what
Minnesota.
Pennsylvania was doing. That's why they had to subtract 200 patients from their COVID-19 death count. Colorado did the same thing.
Yep.
New York went the other direction. New York said, we're having more deaths in a certain period than we normally have, so those deaths must be COVID-19. We just didn't pick them up. So never mind the testing. We're adding 3,700 to our total, and oh, well, that does
Do that even sound right, y'all? Like, listen to what the man said. He telling y'all how corrupt these people trying to like listen to him. Like, listen to him.
increase our total by 50%. So I'm in the position where I have to explain that I wasn't spreading misinformation.
He wasn't.
And I'm not being reckless when I talk about COVID-19 and the influenza both being single-stranded RNA viruses that are respiratory.
Speak on it now. Speak on it, Scott. Speak on it.
In nature with similar symptoms and can be spread through particulate matter and aerosol transmission. I've got an 8-page document that I put together for the Board of Medical Practice. And
8
let me be
pages.
clear, they do important work, and I'm going to fully cooperate with them. I also have some 70 pages of attachments. And in the attachments, I've got the Pennsylvania Department of Health slashing their numbers by 201. I've got
Hey, he got them numbers, black and white. You know what I'm saying? Hey, when it's time to bring out that black and white, y'all already know what time it is.
the Department of Health in Illinois, where one of the directors says that just because we put COVID-19 down on the death certificate as cause of death, that doesn't mean the patient died of COVID-19. She said that.
What?
Dr.
That's how y'all
Fauci,
rocking over there, Chicago. That's how
When he
y'all
talks
rocking
about-
Illinois. What's going on?
influenza. He was the lead article in this New England Journal article. And he said this: if one assumes that the number of asymptomatic or minimally symptomatic cases for COVID-19 is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%. This suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza. That was Dr. Fauci. And, oh, by the way,
That was Dr. Fauci. Y'all heard what he said, right? Hey, look, he bringing up facts. Hey, look, this is what y'all said. So how y'all trying to come at him talking about he informing the people like, nah, he ain't going out like that. Shout out my boy
One of the
S.J.
contributing authors was Dr. Robert Redfield, the head of the CDC. Dr. Osterholm is a well-regarded epidemiologist. And he was saying this in the middle of March. He said, the flu has become a pandemic more than once and has killed millions of people. It still exists today. Unfortunately, we now have on our hands something else, but it's caused by coronavirus, which is acting very much like influenza.
Speak on it. Speak on it. Let them know. Let them know.
Folks,
Let them know.
do I feel targeted? Yeah, I do.
Yeah.
Do I know
I
who
feel targeted.
my accusers are? No, I don't get to know.
I feel you. SJ, I feel you. Do we get to know who our accusers are? No. But we are put in a position where now we gotta try to explain ourselves when it shouldn't even be no explanation or no need to be explained.
Could I be disciplined by the Board of Medical Practice? Well, sure I can. There's 2 allegations they're investigating. If I have been spreading misinformation, then what about Governor Walz and the Department of Health?
What about them?
Right around March 1st, we had a
March
Department
1st,
of
get
Health
that. Hey, write that down.
memo that talked about the purpose of, if you will, some of the measures that would be taken to dampen, delay, and decrease the peak, to allow the accumulation of PPE and make sure that our hospital capacities weren't being overwhelmed. In that memo, they say what effective measures are. Cover your mouth. Don't go out if you have cough or fever. Avoid touching your face, your eyes, or mouth. Cover your mouth if you cough. Wash your hands frequently. Minimize outings. Socially distance. But what did they say were not effective measures?
Hold on. What are they finna say? It's not effective measures.
They said wearing masks is not effective. Taking
Wearing a mask is not effective. Did y'all really just hear what S.J. Scott just said? That wearing a mask is not effective. This is what they said.
antibiotics is not effective. A month later, Governor Walz comes out
Antibiotics.
talks about 74,000 Minnesotans dying. Later on, he went back to 29,000, and right around then, I put a different video out saying just the facts. And I said, I'm not buying 74,000 Minnesotans.
I ain't buying that either, bro.
And I'm not buying 29,000. And then this one came out
Not even close.
on May 1st.
Especially if y'all writing everything down as COVID death. If somebody go in for gunshot wounds, and they die, y'all most likely gonna put it as a COVID death. So I ain't taking that. I ain't trying to hear that.
This is a model that they're using. And it says on here, Minnesotans' model projects nearly 1,000 deaths a day in mid-July. Well, folks, that's next week. So far, we have right around 1,500, of which all but 300 of them have occurred in people in long-term care facilities, in large part because the Department of Health participated in decisions that put people with active COVID-19 disease in the nursing homes.
Did you hear what he just said? They put people knowingly having the coronavirus in nursing homes. Listen to what he's saying.
And I'm spreading misinformation. Of course I am.
Of course he is. Y'all got my boy effed up.
I don't know what to tell you.
I don't know what to tell you.
I just know this is wrong.
It ain't right. It ain't right.
We're in a bad place. My wife asked me the other day, Scott, why did 911 pull us together as Americans so much? And why is COVID-19 breaking us apart?
That's a good question. Shout out to your wife.
I think physicians are part to blame. Scientists are. We've become so darn political. Physicians and scientists in the past are supposed to be above the fray.
Yeah.
They're not. I have this odd set of hats I'm wearing because I'm the vice chair of the Health and Human Services Committee in the Senate.
Speak on it.
And I'm involved in policy discussions and involved in bills that deal with providing relief for COVID-19. And on the other hand, I've been a physician in the trenches for 35 years.
Hey, he was out there in the trenches for 35 years. Hey, speak on it. Speak on it. Let these people know. I salute to you.
So I try to connect the dots. I don't try to present myself to be something I'm not. I'm not an epidemiologist. But yes, I've taken epidemiology
Speak
classes.
on it.
I'm not an infectious disease doctor, but I take care of infectious disease every day.
Speak on it. Let the people know.
I just want to leave you with a couple of questions you could maybe ask yourself.
Think about it.
Do we think it's okay for physicians to certify in death certificates that someone died of COVID-19,
No.
even if there was never a COVID-19 positive test obtained?
No.
Even if there was never a COVID-19 test done?
No. Cut it.
Even if a COVID-19 test hadn't even been considered?
Not even.
And maybe the worst even if the family had no clue that the death certificate they received for their loved one was going to say COVID-19. What do we want to be doing there? In Minnesota, I think the Department of Health is taking care of business.
Okay, so shout out to the Department of Health in Minnesota. Shout out to them people out there. We're going to still look into y'all, but shout out to y'all.
Those are important questions.
These are important questions.
I'm sure there are naysayers out there that think that I'm getting exactly what I deserve. Fine.
We ain't going to listen to
It
them.
happened to me. I think, frankly, that it could happen to anybody.
He been in this game for 40 years. We ain't going to listen to what the naysayers got to say.
It feels ugly. It feels like some of the people that disagree with me don't want to have a conversation. I've asked many of you to have conversations and you've not been interested.
Why not?
So, reckless advice regarding comparisons between COVID-19 and the flu. Spreading misinformation because I cried foul when I received a memorandum from the Department of Health on April 3rd, which directed me to a CDC link, which says clearly that you could have a patient suffering from other medical problems, wheelchair bound, severe stroke within the preceding year or two, no COVID-19 test ever done or ordered,
Ever.
and when that patient dies of pneumonia, it's a COVID-19 death.
Speak on it, my boy.
I cried foul. And I'm grateful that the Department of Health, a week later, tried to clarify things, and a month later clarified it further. But I'll say it again. The official people who write the coding Bible in this country said, if the provider documents suspected, possible, probable, or inconclusive, do not assign COVID-19.
Assign COVID-19.
Thanks for listening. We better all stay engaged. Thank you.
Let's stay engaged, my people. We is not finna assign a certificate of vaccination. Not even going. Now, what I gotta say right there is that I appreciate you, Scott. I'm gonna give you a pat on the back. You deserve an applause. You deserve that, my brother. You deserve that because they trying to take your shine. They trying to take your voice away. And with that being said, I'm right here to speak with you. I'm right here to walk with you. And I'm right here to make sure that your voice continues to go. We ain't stopping. Point blank, period. Everything you said, I felt as though it was the authentic truth. And now that these people are targeting you because of what you might know, what you have found, not only does it bother you, it bothers certain individuals like me. When you really are going against the communist false narrative, that's when people look at you as something that they have to get rid of. Like he said, it can happen to anybody. We are warriors, not worriers. This ain't gonna phase us. These people are forcefully trying to make it where they are in control. So with that being said, I'm proud of certain individuals like Dr. and Senator Scott Jensen for talking about the COVID. What it seems that we are dealing with here is medical Marxism and media Marxism. Do you agree? Because as we all know, not only that, all the COVID test kits have been contaminated. Not only that, and when I mean contaminated, they have been contaminated with the actual coronavirus. Not only that, people are in fear. And what they really don't understand is fear is false evidence appearing real. It doesn't exist. Not only has Scott spoke about it, Judy Mikovich has spoke about it. These great scientists, Dr. Shiva has spoke about it. These Dr. Sebi, these great scientists, and yes, I'm putting him up there with them scientists, has spoken about certain things. And once the truth get out, I feel like certain individuals do what they all to make sure that the truth don't spread. We have to be consciously conscious of everything around us. We have to be mindful and aware of everything that's going on around us. Because like he said, he feel in very much of disgust knowing the fact that he's been targeted for just speaking the truth. And we know that most of these diseases are retroviruses, that most of the diseases are diseases put with another hybrid disease to make something even worse. We know that if you take the flu shot, you're most likely going to get the flu. And what makes it such even worse is that he can't even see who these people is that's disagreeing with him. These globalists, these high elites, these deep state members. What we know is that certain individuals will go to the furthest extent to protect their secret. Y'all seen what that did to Judy Mikovich when she was trying to speak upon HIV, when she was speaking upon COVID-19, when she was speaking upon XMRV, when she was speaking upon CFS and ME, when she was speaking upon all these certain diseases and things that put your body in dis-ease. Y'all try to stop her. Now we're seeing the same thing happen with Scott. And nothing better not happen to this man because, like he said, he feels targeted. He got people threatening him, his own physicians. That's something I don't understand. What I got to say is that common sense is not always common practice. If you practice common sense, everything and anything is possible to happen. And then we already know that character is based off what you do for a person that does nothing for you. What y'all doing to this man, and the only thing he trying to do is do right for the people, showing y'all real character. So y'all aware of the Agenda 21. I'm sure that y'all are aware that the World Health Organization has bits and parts to do with some of this too. That the CDC has a lot of bit of everything to do with this too. Power is organized knowledge expressed through intelligent efforts. And if you express your thoughts through intelligent efforts, you have power. So let's take this, what we just learned, as a big lesson learned. That these people, knowing that what they doing is wrong, will continue to put others in a position where they can't speak the truth because certain individuals don't want a secret to be out there because of their own agenda. Speak the life you want into existence. Go out there and be great. Go out there and accomplish anything you put your mind to. Understand that you can become anything you put your mind to. I know that the biggest part of me is non-physical, and you will never see it. I'm doing my due diligence by giving y'all these little glimpses and certain different type of reflections of the person that I see myself being. So with that being said, I appreciate y'all. Speak the life you want into existence. I want to just say, Dr. Senator Scott Jensen, I appreciate you, and may your voice go on and may what you said be heard. Because now that we only know that the coronavirus, not only do we know that the coronavirus is a planned virus, now do we know the coronavirus is here to weaken the immune system and depopulate the world. We know that certain individuals don't want the truth to get out about what's really behind this or who's really behind this. So with that being said, I appreciate y'all. Speak the life you want into existence. Go out there and be great. I appreciate you, Judy Mikovich. I appreciate you, Dr. Shiva. I appreciate you, Dr. Sebi. I appreciate all my great scientists out there that's working hard day in and day out to make sure that the people get in tune with information that we need to understand. Because without this information, we can't go on. Did y'all hear what he said? These masks, they don't do nothing. Consider this. Could it be that your mask is used as a muzzle just to shut you up and keep you from speaking your thoughts and speaking the truth? Could these masks be to cover up the real fact that you are being controlled, not only physically but mentally? Could it be that these people want you to be in a sense of fear, false evidence appearing real? Because as you just heard, masks doesn't do anything, neither does antibiotics. So y'all let us know what the truth really is.